This original WSRE presentation is made possible by viewers like you. Thank you.
The Affordable Care Act makes health insurance affordable to millions of Americans, many of whom are least likely to have it. Hi, I'm Dee Dee Sharp, and welcome to an Aware Town Hall, where we'll tell you what you need to know to get the best insurance options at a price you and your family can afford. In addition to the live studio audience you see here at our town hall, we have invited a panel of national and local experts to discuss in a nonpartisan manner the Affordable Care Act, getting the facts straight. But before we get to that, let's get to this, some important numbers here for you. According to the U.S. Census Bureau, more than 48 million Americans do not have health insurance. Florida has, get this, the second largest, highest rate of uninsured residents under 65 years old. 4 million Floridians, or 25% of our population here, do not have health insurance. And in Escambia County alone, 54,000 of an estimated 302,000 residents are uninsured. And that brings us back to our Aware Town Hall audience for a quick poll of what they have to say about all of this. Want you to raise your hands if you have health insurance. Now take a look at our audience here. That's a good number of folks who do have insurance. Now, by a show of hands, once again, want you to raise your hands if you know someone who does not have health insurance. Just about the same number of hands shown here for that. So you can see why this is so important that we get information out about the Affordable Care Act, because they're not alone. But we want them to know that help is on the way to educate them and you on the Affordable Care Act. So joining me now in our studio are our guests. They include nationally recognized experts on the subject matter from New York University Langone Medical Center. And they're also hosts of Healthcare Connect on SiriusXM Dr. Radio, so we're excited to have them. We begin with Drew Rubin, Vice President for Medical Center Clinical Affairs and Affiliates. He's joined by, of course, his co-host, Matthew Penziner, Senior Director for Managed Care at NYU Langone Medical, and also Allison Vogel, Vice President of Managed Care, also at the Medical Center. And she's also on the radio show as well. Next, we have this face, local expert who includes Stephen Rome, an advocacy volunteer and spokesperson for American Association of Retired Persons. In short, we know that as AARP, Florida. And last but certainly not least, we have Cory Brown, certified navigator with Families Count, a nonprofit organization that provides community resources for those in need. Hi, and everyone. We want to welcome you to our show this evening. And of course, we did not give your long list of resumes any justice by what I just did, because we only have limited time for me to talk. So I want you to talk. Andrew, we'll start with you. Tell us a little bit more about you, what you do, and a little bit about why we chose you to be one of our experts tonight.
Okay, I'll keep it brief. But I was born into the healthcare system. My father was a physician. I worked in hospitals and high school, operating rooms, mopping the floors, wheeling patients around. I got educated in finance and accounting, and then went back into study healthcare a little bit further. And now I work for NYU Langone Medical Center, and I run the operations for our physician organization, which basically employs about 1,200 physicians. So that means when you go to the doctor, one of our 1,200 doctors, I run that business for them. And about 5 years ago, Allie, Matt, and I started a radio show on SiriusXM called Dr. Radio. Healthcare Connect is the name of the show, where we every week take callers from people like the studio audience, answering all their questions about navigating the healthcare system, long before healthcare reform was part of the picture. They're just explaining how the system works.
Very good. Thank you so much. And he really did keep that short, trust me, because it's long. His resume is very long. Allison, tell us a little bit about you.
Sure. I work with Andrew also at NYU Langone Medical Center. I work in the Office of Managed Care, and what our primary role there is to work with the insurance companies, working with them to negotiate the contracts between our physicians and the payers. So when patients come and access our doctors, what we're going to get reimbursed, fixing any of the claims problems we have. And also my background includes actually I've worked on the payer side as well. I've worked for large national health insurance companies, so I've seen both sides working on the provider side and the payer side, which has always been interesting. And as a mother, I have 3 children. I'm accessing the healthcare system all the time. So it's something that I'm very familiar with.
Very, very good. All right, Cory, on to you now.
I'm actually retired Florida Department of Corrections as a supervisor. I stayed home for about a year or so to stay home with my 2 teenage daughters, and then I decided to seek other employment to help folks, and started out with Families Count. It is a nonprofit organization that helps numerous folks, and currently a licensed navigator, and we serve 10 counties right now from Escambia through Bay counties.
Okay.
We're here to assist.
Very good.
Yeah.
We're glad to have you here.
Thank you.
Stephen, to my left.
Yes, I retired about 7 years ago and decided I needed something to do to keep me occupied, so I joined AARP, which, by the way, is what we prefer.
Okay.
And I've been interested in healthcare. I'm a user, of course, of the system. Since I'm 66, I've been on Medicare for the past 2 years. And I try to stay informed about what the Affordable Care Act does for Medicare, and also for the population that we serve, which is 50 to 64 who are not on Medicare.
Okay, very good. And last but certainly not least, Matthew.
Thank you. So I work with Allison and Andrew at the medical center as well. I started my career in healthcare right out of college. I worked for a large insurance company, just like Allison. And now at the medical center, I'm basically a liaison between the provider offices and the managed care companies. So a lot of questions come through us as how do the patients access care, what can they do, what can't they do, what's the contract say, and then any resolution that has to go around that. So we're always involved on all aspects of the insurance marketplace.
Okay, and we're used to you all talking satellite radio together, so we kind of separated you now. So we'll see how that goes. This is how you sit in the studio? That's wonderful. See, we had that. All right, we have a lot of ground to cover, and we're going to get started now because I want to talk in generally about healthcare reform, and then we're going to zoom in and focus on specifically the Affordable Care Act. Andrew, any of you, we can start from that. Healthcare reform.
I'll start.
Okay.
I like to explain to people when because they're hearing so much on the news these days. First, we have to remember before healthcare reform, quite frankly, before President Obama was elected, healthcare is the single largest expense in the overall economy. It represents, I think it's about 18% of the overall economy now. So the way I like to make that sound real to people is 18 cents of every dollar in our wallets that is spent in this country is spent on healthcare. So it was long before healthcare reform came into the picture, it was a really big part of this country. And we know that in this country we have a somewhat inefficient, what I would define as broken healthcare system. As good as it is, we leave, by your statistics alone, 40 to 50 million people out of that system, meaning they don't have access to the healthcare system for a whole host of reasons, whether they can't afford it, they have pre-existing health conditions that exclude them from participating in the insurance markets to get access to healthcare. So there were a lot of problems. The other big piece of this that I'd like to point out to people is that a lot of people don't understand healthcare because they don't use it, and that's a good thing. But it's not until they actually need healthcare services and they actually need to access the healthcare system that they enter this web of confusion and rules and insurance coverage or not insurance coverage and access that's very difficult to understand. And then we reformed the whole system, or started to reform the whole system. So we took an already confusing system that most people didn't understand and made it even more confusing. Then you put in politics, whether you're conservative or liberal, and you mix that all together and you got a crazy mess out there. But healthcare reform is basically really divided into 2 pieces. One is healthcare delivery reform, which not a lot of people are talking about, and the other is health insurance reform, which is what we're going to spend most of the time talking tonight about. But I think it's important, at least to say up front, that there's a lot of work going on right now. It started years ago, and it's going to continue no matter what happens with these health insurance exchanges, where doctors and hospitals and insurance companies and Medicare and Medicaid are going to look at new ways to deliver health care to their members, to the people of this country. It's not about rationing care. It's about delivering health care in a more cost-effective, efficient way that results in better patient outcomes for people so that they're in the hospital less, they're at home more, they stay out of the healthcare system altogether if we can keep them out of the healthcare system. And there's a lot of work being done on that. And the outcome of that work, which is really in the early stages, so we can't really talk a lot about it because it's hard to understand right now for a lot of people, and we don't have a lot of data to say what's going to happen. But what the goal is to spend less money unnecessarily and spend the money we have more effectively. And that's, I want to make sure people understand, that's not rationing. That is delivering better, more cost-effective health care so that becomes hopefully less expensive for people in this country. We'll see if it works. And then what we're going to talk about the rest of the night, healthcare insurance reform.
That sounds good to me. We'll get to some definitions in just a moment. But first, with what you just said, I want to kind of turn now to more or less the Affordable Care Act itself and what it means. And we can let either of you actually take dibs at explaining that.
Well, explaining the healthcare reform is very, very difficult. As Andrew said, the system was not well understood before, and now we've thrown a whole other set of rules in it. But one of the things I think that healthcare reform does is to provide rules that make the insurance companies present on the individual market to present policies that are the same and provide the same benefits so the consumer can evaluate apples to apples. It's like having a football game. Prior to that, we had a football game where there were no rules. Well, now we have rules, and the best team, hopefully most of the time, can win. And in this case, the consumer has a better understanding of what they're purchasing.
All right, we're going to talk about those rules in just a moment, but first we're going to start with some definitions so that people can understand what we mean when we start stacking up those rules. We'll begin now with health insurance marketplaces. We'll also talk about insurance exchanges, subsidies, individual mandates, and penalties for not buying insurance just to start. So also showing on the screen, state-operated health exchange, exchanges run by the federal court, pre-existing conditions, and deadlines. But first, let's get back to health insurance marketplaces. We're hearing about it all over the news, but for the most part, some of us don't quite understand. And when we don't understand something and we're used to change, we're not used to changing, and all of a sudden we have to change, we get scared, we get worried, we start to panic. So let's just start trying to break some of that down by explaining the definition, starting with health insurance marketplaces.
So I think the easiest way to describe the marketplace is try and make it synonymous to something we all use every day. So we all use Travelocity or Expedia, a place where you can go and compare different options easily and then decide which one you think is best for you, whether it's a hotel or a flight. So this is the same concept. It's a place for individuals or small businesses to go and lay out their insurance options and see which one, with the prices and the benefits and all the different packages, hopefully in an easy to use way. It hasn't been that easy so far, but hopefully that's changing. So they can make the right decision for themselves and their families, and they'll see how much it will actually cost, and if they're going to get a subsidy, how much that subsidy will be. So at the end of the day, they can see their final price for the year. So it's really just an easy way to buy.
Okay. Insurance exchanges. Let's talk about that right quick.
Well, that is actually what Matt just described. So
okay.
the law as it was deployed was basically healthcare insurance in the United States is regulated by individual states. So people don't necessarily know that. Now, Medicare and Medicaid are federal programs. Medicaid is a federal and state program. But health insurance that I buy in New York, for example, from Blue Cross Blue Shield, is regulated by insurance commissioners in New York, which means it's going to be different than the insurance Blue Cross Blue Shield policies that are sold in North Carolina. In fact, they're two different companies with the same name. So the law was intended to allow individual states to establish their own marketplace where people, like Matt described, could go on and buy health insurance in a transparent, open way, comparing different policies, different levels of coverage, and different pricing, all laid out simply so people can understand it. What happened was, because states have the option to either do their own exchange or not, if you live in a state where the politics were such that the state didn't want to get involved in healthcare reform, that job was left to the federal government. So right now we have about half the states operating their own state exchanges, the online marketplace where you go and buy insurance, and the other states, 50% of the states, like Florida, where the federal government is running that exchange for them. What you've been hearing in the news is the federal exchange, which was never intended in the law to actually be necessary, although they knew it was going to happen, is taking the place for the states that didn't want to do their own exchanges, and it's not working right now. Period. It's not working.
Okay. And just a few more, and then we'll just kind of open this up a little bit more. Penalties, well, individual mandates and penalties that people would have for not buying insurance.
Sure.
Allison?
So an individual mandate. So part of the whole Affordable Care Act was to get everybody in the game. So right now we're quoting the numbers of so many uninsured Americans. In order to insure everybody, people who no longer have pre-existing conditions, that's one of the major factors of healthcare reform, is that there'll be no more denials for pre-existing conditions. So the fact that you're going to be able to insure people that have a history of being sicker and accessing more care, utilizing more services, putting them into the game, you have to dilute that pot of people who are going to spend more with the healthier people. So in order to get everyone in there, there needs to be some kind of mechanism to require everyone to go out there and buy insurance, which is where the mandate came from. So the law was written such that everyone has to have insurance, and if you don't, you will have a penalty for not purchasing it to try to force everyone into the marketplace. It doesn't seem, I mean, as of right now, the penalty for the first year is a low dollar amount. I believe it's only $95. It's going to gradually go up over time, and it's all factored in through your taxes. But that's what the individual mandate is, and that's why it needs to be there in order to get everybody into the market to buy insurance. So we have to have everyone there.
It's not palatable to a lot of people because it is, any way you slice it, it is requiring people to do something that they may not like to do. Now, what you also frequently hear is, well, if you have a car and you drive the car in the state of Florida or New York or wherever you live, you're required to have insurance on that car. So it's the same concept. But for some reason, and there are many reasons, a lot of people never really liked being told they had to have health insurance. And it's made it very difficult to get people, particularly younger people, who consider or see themselves as immune to getting sick. And we know it can happen at a moment's notice. It's less frequent, but it happens. So people who view themselves as immune to this, not wanting to sign up. And if they don't sign up and we don't get everybody in the game, it doesn't work.
That was going to be one of my questions.
It simply doesn't work. The numbers don't work.
It's hard to understand that people would consider it being more important to have insurance on their cars than they would themselves. And then we know there are those who don't necessarily have insurance on their cars who drive illegally.
Well, sometimes people just can't afford it.
They can't afford it.
You know, with you're 25 years old and you're right out of school or you're working and you're thinking about starting a family and you want to buy your first house and you're struggling to make ends meet. It's not that you wouldn't think, well, I'd love to have health insurance, because you probably would, right? But
it's
$100 a month, $50, whatever the policies for young Americans have always been inexpensive. But it's still out, it's money out of your wallet at a time when you really don't have a lot of money in your wallet in the first place. And so sometimes it's philosophical and sometimes it's just practical. I don't want to spend the limited money I have on something I probably won't ever need.
Allison?
And there's so many people that we hear this a lot on our radio show where people say, you know what, I'm pretty healthy, I don't get sick a lot. If once or twice a year, if I'm not feeling well, I'll go to the Minute Clinic or I'll go to a local clinic in my community and I can see a nurse practitioner or a physician and I can get a prescription for antibiotics and it's going to cost me maybe $100 or $200 a year to access when I'm not feeling well. But unfortunately, it's those catastrophic instances that you're not expecting. It's the fall when you break a bone, or the unexpected diagnosis, God forbid, of you go to the dermatologist and there's a mole on your skin and it turns out to be cancer. It's when you don't expect it, and then at that point, it's those catastrophic illnesses that can unfortunately lead somebody to bankruptcy. I mean, we see that the cost of accessing healthcare, once it's not just a doctor's office because you have a cold, once it's seeing a specialist, needing a CAT scan, an MRI, pathology services, and then everything just snowballs from there. And at that point, you're in the healthcare system, you need care, you're lost, you're confused, and you're most vulnerable because you're ill, and now you don't have any insurance. And that's what this was intended to do, is to prevent people from going into bankruptcy because of something that is preventable, a financial situation that theoretically is preventable. Because if you have insurance, even if it was one of those plans, as Andrew had said earlier, where you can get a high deductible plan where you may have $5,000 out of pocket, but if God forbid you need to have cancer treatment, $5,000, that's nothing of what it would cost you to cure you or go through therapy. So, that's really why that was a big impetus of this, was to prevent the American public from going into medical bankruptcy any further.
Figures we used back when we did healthcare reform in 2009, same basically today. Most of us live one catastrophic illness away from bankruptcy, because that's what it can do to us. And so this is very serious. We're going to get into some very deep discussion in just a moment, but before we do that, we're going to start with the notion of this Affordable Care Act and the fact that it's sometimes referred to as Obamacare, and that was supposed to be something negative, but it has actually been embraced now by President Barack Obama as Obamacare. And I say that because some people don't choose to use that term necessarily, and I want you to talk a little bit about that, Stephen.
Right. The term Obamacare was first brought out as a derogatory term for the Affordable Care Act. And we at AARP prefer to call the act what it is, the Affordable Care Act, and take the politics out of the subject of the care. Obamacare now, I know that President Obama has said if it's his name, he's happy to embrace it, but we still feel it's a somewhat derogatory term.
And Andrew, you have a slightly different view on that.
Yeah, I was thinking about it after Steve and I were talking about it before we came on air. I know to Allison, Matt, and myself, because we talk about this every week on the radio, we really are. We do believe in healthcare reform, but we are not. We are neither conservative nor liberal. You will never know that after tonight, and you won't know it after listening to us on the radio. For us, and quite on a personal note, I grew up the son of a physician. I make my living in the current healthcare system, right? So I am like everybody else in this room, one catastrophic illness away from bankruptcy if that happened. I have more at stake in the healthcare reform than a lot of other people do. And I still support it, regardless of my politics. And I work for a physician organization. I run a 1,200 physician medical group with $1 billion a year in revenue. So I get this. To me, when I started calling Obamacare on the radio, I thought that what better way to take a negative and make something positive, because I believe so firmly in it. So I actually agree with Stephen. It is a derogatory term, and I think that many people still use it that way. But because I believe in it, I wanted to change the perception of what that word meant. That's the only reason.
Anybody else have any comment on it that they want to share before we move on?
I felt the same way as Andrew. We actually didn't use Obamacare on the radio show until the president actually embraced it. So once he started using it, we felt it was somewhat okay to start using it, because it did start out with a negative connotation to it. But now, I personally just think it's easier to say, and I think more people understand it. We were talking before the show. If you were to walk, around the corner and say, "Do you know what the Affordable Care Act is?" People may say, "I'm not really sure." But if you say, "What's Obamacare?" more than likely they're going to know.
And that's why I wanted to bring it up here on the Aware Show, the Obamacare name. And in fact, if President Obama were here, he would say Obama cares. It's Obama does care, so Obamacare. So if we are alluding to that tonight, then it's okay, I guess, for the most of us here on the panel if we do that. So we just wanted to get that out there. We want to get to some other things here, because I know our town hall guests are just burning with questions. I have a slew of them that they have already been sending in, and we're going to get to some of those in just a second. But I want to get to what you do right quick, Cory, and then we'll be off and running. You are a navigator, so if someone has questions or they want to get information, they're going to come to you. And then what will you do?
Yes, I am a licensed navigator. There are a couple others of us that do serve the 10-county area. When people are interested in signing up and they need assistance, they do call our number, and we actually set up appointments for them. We meet with them, and we can enroll them by the online, the healthcare.gov, or we can call it in, and we're able to help them understand some of the plans and some of the questions that they may have about the enrollments. And we're just very unbiased and try to guide them the best way that we can for them to make an educated decision about their health plan.
Okay, very good. Now, there's a lot of apprehension out there right now. We're getting in information almost daily about changes and that sort of thing. And just as recently as, this week, the president coming out and making some statements about some things that he's trying to do now to fix what's going on with the online marketplace and that sort of thing. Can we just kind of bring people up to date with where we are with that, and then we'll really dive in here. Andrew?
So when healthcare reform started out, you have to remember the president had a very tough sell, because while there's 30 to 40 million or 50 million uninsured Americans, there's 180 million Americans who get insurance from their employers today who really like what they have. And we were all at that point a little bit suspicious about what this meant for us. So we started, the president at the time started saying, if you like your insurance, you'll be able to keep it. What's happened is, as the law has evolved, the rules came out. So the law is 1,100 pages, right, Matt? Yeah. So the rules, the law is 1,100 pages, but they don't have the detailed rules in that. The 1,100 pages then gets written into thousands more pages of how this thing actually is going to work for people like us. And what happened was the insurance companies were required to have all these minimum coverage levels and benefits included in their insurance packages, which for the most part made a lot of individual policies sold in this country not disqualifying them from being able to be sold under healthcare reform. So what has happened lately is the insurance companies have been sending out cancellation notices to their members across the country because the policies didn't meet the standards that were needed under healthcare reform, and mapping them to new insurance policies. So they were being dropped, but they were being offered new policies. And then what unfortunately happened after that for many people, and no one knows the exact numbers yet, is they were mapped to a policy that is now more expensive. And the insurance companies were saying that was because we're being required to offer more benefits than we used to offer, and different deductibles and different out-of-pocket amounts, and that happens to be true. For many Americans, they'll be eligible for a subsidy, but for many Americans, they won't. So there are a lot of people in this country who are actually now on the opposite side of the benefit spectrum, where they're actually going to be paying more for essentially what they view as the same healthcare insurance. And you can understand why people would be upset about that. So responding to that criticism, the president yesterday came out, while we were on air, came out and said he was going to administratively...
Yesterday being November 14th.
Excuse me, November
No
14th,
problem.
I apologize. Came out and administratively is making rule changes that allow insurance companies, if the states, remember what I said earlier, insurance is regulated by the states. If the states allow the individual insurance companies in their states, and the insurance companies agree, they will allow those policies which would have been banned under healthcare reform to stay intact. And people who are already enrolled in those policies, not new members, but people who are already enrolled, the dropped people, would be able to stay in the policies if they're still available in the state. Well, that was a nice gesture, I think. I think it showed that the president was willing to consider changes. The problem is it's probably not going to work. The insurance industry has come out pretty much saying this is an unworkable situation, because they priced all their policies and they restructured their healthcare insurance products to meet the standards of healthcare reform. So to grant a one-year extension throws all of that out of balance. Remember, insurance companies, we in this country wanted the private insurance marketplaces to stay intact. I know I did. So they were being forced to work under these new rules. And they priced their business models to work under those new rules to meet these new standards. And they actually went along under healthcare reform. And then we changed the rule. The president offered to change the rules of the game yesterday on November 14th, and that put a lot of insurance companies and state insurance commissioners in a really difficult position. So I think that many are not going to actually be able to, even if they wanted to, continue to offer those policies.
The other thing, Andrew, is it would be a one-year extension.
Correct.
So you would get 2014 to keep your plan, but then you'd have to switch to one that would meet, the 10 essential benefits. So he's just giving you an extra 12 months here. This isn't going to go on forever.
It's intended to allow the insurance markets to settle out. Remember, if you live in a state like New York or California, there are a lot of insurance options available to you. A lot of companies are selling insurance on these state exchanges that Matt described before. But if you live in North Carolina, there aren't that many options. So I think the intention is to say, let's give this another year to work, and let's see what happens, and maybe more insurance companies will enter the market when they see it does work. Unfortunately, I don't think that's going to happen.
Part of what Matt was touching on was what's called the essential benefits package, which is what's a key component in healthcare reform, is requiring and ensuring, protecting the American public that when you do have to, so now we're telling you have to have insurance, but we're going to ensure that the policy that you're sold is going to cover everything that you're going to need. It's going to be a comprehensive plan. The way things have been in the past, you can go out and buy an insurance policy, and it may not include coverage for maternity care or cancer care, or it may be very limited. It may cover you up until $40,000 or $50,000, which is really a small number. And there have been a lot of people who don't realize that that's what they purchased. So part of what the goal was to ensure that everybody, it's to level the playing field. Everybody's covered for everything. And now with this change that Andrew's speaking about, that President Obama has said, don't worry, we're going to let you go one more year with the policy you have. So that's one more year where people who may have coverage that is insufficient or not comprehensive enough under what the goal was to get them to today. So, it's a gesture to the American public that was frightened off. These are individual policies, people that go out and buy their own insurance on their own, not through their employer. But in the end, you're not really getting the protection that the Affordable Care is supposedly going to be delivering to you.
Go ahead.
That was what I was going to say, is that some of these canceled policies were very catastrophic policies. Yep. They did not have a lot of coverage, and people didn't realize that. The premium was very low, and that's what they wanted. They didn't look at the benefits. And when they go on the exchanges, a lot of people are finding that the policies with the refunds on tax, that the policies are less expensive than the policy they had before and provide better benefits.
Well, I think that speaks to the overall problem with what's happening now, which is what everybody's hearing in the news. You can't go on the exchanges because they're not working right. So people are getting policy cancellation letters, and they can't figure out that there's actually potentially something better available to them. And in some cases, by the way, it's not necessarily available. There are many people who are losing policies that really are pretty okay and do meet their needs. They're not as good, but they're pretty good. And they are now more expensive. But the bulk of the people, in fact, the reason this is so topical, there's so much controversy right now, is because the healthcare exchanges that we've been talking about don't work. So the enrollment numbers released in mid-November are showing that not a lot of people have signed up. It's not because they don't like healthcare reform, it's because they can't sign up. Cory and I were talking earlier, she's a Navigator. She can't enroll people because it's not working.
And how is that going for us here? And just piggybacking off what Andrew
Well,
said.
we try to help, the consumer when they call and get online has been extremely frustrating numerous times. We'll get all the way through application, and then when it's electronically signed, we can't do it, so we'll have to start over. There's times where we've had to call in applications, and they'll do like a PDF file, and we'll check on it a week later. We've run into issues a couple of times where that application is like non-existent. But for the most part, We have done numerous applications that have gone through. A couple of them we've seen that are able to see the plans. So for the people that we have now signed up, I'm getting calls now, can you help me pick out a plan? Can you help me, understand better? They may have 86 plans come up and they don't know what to do with it. So we're, able to guide them through the process to make an educated decision, based on their needs and their budget. So,
Very good.
Yeah.
We're going to take a moment to invite our guests here at the town hall to take to the podium if they have any questions. In the meantime, we're going to go to some of the questions that we did get from the audience already, and one of them goes to you, Cory, and the fact that you just got through talking about this. One of our guests here in the audience wants to know how they could become a navigator.
First of all, you would, like we did, we have funded through a grant with the University of South Florida, and Families Count wrote in, and that's how us navigators are paid. We had to go through and take it's an online course that we took, and we had to get certified, and then we had to go and apply for license, and they did a level 2 background check on us, because there are just 3 of us at this moment serving the 10-county area. Okay. So we do stay extremely busy, but I would say contact Families Count and see if they could assist you with that.
Okay, we want to thank our audience member who gave us that question, and we have a young lady standing at the podium with a question of her own. Please give us your name and tell us what area are you from.
Sure. Hi, my name is Lindsay Milchtime, and I'm living in Gulf Breeze. And I want to thank the panel for being here. This is a fascinating conversation. So my question is for Mr. Rubin. You just spoke about the enrollment numbers, and we're frustrated because the website's not working. One of the critical pieces of the law is getting enough people enrolled into these insurance pools to make the risk balance work. What is going to be the outcome if we can't get enough people enrolled in time?
I think that's a great question. I think I have a funny feeling there are going to be a lot of good questions tonight. So here's what happens. I've been talking about healthcare reform now for what, 2-3 years? 2010, March 2010 is when the law passed. I never expected such an abysmal rollout. I'm probably more disappointed than someone who needs to actually get health insurance, because I'm lucky enough to have it. It has to work. Once I think, they're saying the end of November. I don't know if I believe them. I want to believe them, but I don't know if I do. If it doesn't work soon, they're going to have to scrap the whole thing, right? Because it won't work. So I think that's more a theoretical question, because I know once it starts working, people will start signing up, because we just have a radio show. It's not a statistically valid sample, but we know a lot of people want to enroll because we talk to them all the time, and they can't. So they definitely will. So I think we'll have to just wait and see how this plays out.
And thank you for your question.
It's a good question.
A great question. With you all doing your national show on Sirius XM, you get a lot of questions. What are some of the big concerns nationally that you're hearing?
Well, lately it's not so much a concern, other than the obvious, I can't get onto the state exchanges. I think it's interesting, as Lindsay was asking her question, I'm like, we get a lot of calls from Florida, and we get a lot of calls from the Carolinas. And I'm not 100% sure why, but it is interesting. And those are 2 states where many people have been dropped from their insurance companies with their existing policies and being routed to new insurance plans. So I think that's a big concern we've been hearing. I want health insurance. I liked what I had. I lost it, and they're mapping me to a new policy that's more expensive. And I think most of our calls, I think, Allie and Matt, I don't know if you agree, but it's people who just don't understand that it's available yet. Right. Again, all they hear on the news is the fighting in Washington. But there's no one really. So we're getting caught up
with the politics.
Well,
there's
not a lot. The reason we came down here was we were so excited that there was a place in the country that wanted to have a conversation to help a studio
audience. We need it in Florida. Thank you for coming.
Understand how it works. This is incredible.
I think the other question that we get a lot for the people that have had access to the website is, they see the price and they say, how can this be? We had a caller the other day say it's $300 less a month, and the plans look exactly the same. How could this be? So they want the nuances. What they don't realize, and we try and tell them this all the time, just because you had Blue Cross Blue Shield 2 years ago doesn't mean that it's the same Blue Cross Blue Shield that you're going to have in 2014. The same hospitals might not participate, the same physicians might not participate. So what the plans are doing is limiting what providers they're going to have in the network, and thus lowering the cost. So just because it's Blue Cross Blue Shield and you loved it 2 years ago doesn't mean it's the same one today. And we get a lot of calls about that on the show saying, what's the difference? Is it still really just Blue Cross Blue Shield? The answer is no. Okay. You really have to go through the details.
Which is why during open enrollment season, without healthcare reform, we always tell people, read the fine print. The fine print's easier to read now. If you actually are lucky enough to get onto an exchange, the state exchange or the federal exchange, it's intended to be more readable. But you got to read it. It starts with you.
Okay.
And a lot of times we actually guide our listeners to what questions to ask their doctors. You know, if you're making open enrollment, even if you're getting your insurance through your job, and again, this is open enrollment for us right now too, because our benefits, you know, start again in January. Ask your physicians, ask your primary care doctor, your child's pediatrician, the hospital, the clinic that you access very frequently. Are you going to continue to take this insurance come January? Because this is the time when a lot of physicians, a lot of healthcare providers are deciding what they're going to do come January, if they're going to stay in network or go out of network. So like Matt was saying, a lot of the plans, you know, Blue Cross, they have 15 different products out there in one county possibly. So you got to look at the name of the plan on your card and ask that pointed question. Are you going to take Blue Cross PPO Open Option 2 or whatever it's called? You need to be that specific to be an educated consumer.
And that's why we wanted to do this show. The Aware Show is all about educating and informing people, and this is so complex sometimes with all that's going on with it. We need to educate people on what this means to them and their families, and that it is something that can be helpful. And the big picture is that while state, federal insurance, TRICARE, we mentioned that, those sorts of insurances that are out there are pretty much the best that they're going to get, those employees. They're not changing.
TRICARE is not changing.
None of that's changing. That at the end of the day, the things that we need to be concerned about when we have employer-based insurance and that sort of thing is just to go out there and shop the market anyway, just to see if it can help us. And I know that we're talking about one of the biggest problems with that being able to get online, but there are other ways that people are I guess, trying to do this as well. So please help us.
You know, we've had online success, and we've had a lot of applications we've had to call in. Have been very successful.
That's what I want to get to. Call in, and some people are doing paper applications too as well.
They are just maybe a couple, you know, that I know of, but on the most part, people are getting their applications in and getting them done, and they are successful.
Okay. So no excuses.
No, and we're getting them done, and that's why when we found out, you know, like one wasn't going through, well, we're going to double check this. Let's check into it.
We'll figure it out.
We'll figure it out. Homework and all, but another issue like they were talking about that I really see are those policies that are being canceled. People calling in need some help.
Okay.
And
Andrew mentioned that he's getting a lot of calls from his show. Allison and Matthew, their nationally show on Sirius XM from Florida and North Carolina. I want to just kind of ask you here in Florida, why do you think that is so? And I'll ask that to you, Stephen.
Well, I think one of the problems is that Florida refused to take the Medicare expansion funds that were available, and they kept the navigators out of the community health centers so that people believe that it's hard to get answers and be able to apply for insurance. I believe as people like Cory, there are ways to get in, there are ways to get to the exchanges and find out. But people have been scared off in the states that do not have state exchanges. And I have a question for Andrew and Allison.
I love it. Our panelist has a question for a panel member. Go ahead.
My sister called the radio show. She had a question too.
It's bad when your mother calls. Do you find that the states that have their own state exchange are people able to get on easier
Yes.
Than the
Unequivocally,
than
yes.
the healthcare?
It's not perfect. Remember, the state-based exchanges, New York being one, California, Connecticut, Kentucky, many states, they rely on the federal exchange technology behind the scenes to do a lot of the processing work. So as Cory pointed out, they are now starting to get applications through because they're making changes every day. They're working, thousands of people literally are working around the clock because they have said they're going to get this fixed by November. But the states like New York and California, if you actually, there's websites out there that'll show you have enrolled many more people. But Stephen said something important. The way the subsidies work for many people is that if you make less than up to 400% of the federal poverty level, which is about $90,000 for a family of 4, and down, you're eligible for a subsidy. But if you make 133% of the federal poverty level, which is about $22,000 for a family of 4, or $13,000 for a single. Now, these are estimates. I don't. Matt usually checks me. You're automatically eligible for Medicaid. Now, if you live in Florida, and this is where your viewers are, you will not be eligible for Medicaid because Florida has not accepted the expansion of the Medicaid program. And if we have time at the end of the show, I'm happy to talk about that. But right now, why and what that means in terms of how the money flows. But basically, of the statistics that you showed us at the beginning of the show, I think I forget the numbers, big numbers of uninsured in the counties that surround Pensacola. Mm-hmm. Many of those people would be eligible for Medicaid. And when they do go online, they're not going to be able to get health insurance until the state legislature in Florida and the governor come together and agree to expand Medicaid.
This is bad news for those
It's bad
folks.
news for consumers. It's very political, so that's why I don't like to, I'm not going to put it in political terms, but if you are somebody who works hard and wants health insurance, and if you live in New York, you're entitled to it, but if you live in Florida, you don't. That's hard for me to understand. There are reasons behind it. Healthcare reform, for the first few years, the federal government pays 100% of the costs of expanding Medicaid, but after the first few years, it goes down to the states will have to pick up 5% of those costs, and there are a lot of states, they tend to be more conservative states, that do not want to take on that 5% burden. Now, the government's paying 95%, but the state doesn't want to pay the 5%, and that's what the fight is about.
Do you have anything you want to add to that,
Yes,
Stephen?
in the state of Florida, we left 1.1 million people uninsured because we refused to take the Medicaid expansion. And of those 1.1 million Floridians that we now have thrown under the bus, basically, I think 300,000 of them are children. And to me, that's just unacceptable.
Okay. All right. Well, we have a young lady who's been standing at the podium for just a minute now, and we want to get to her now. Please give us your name and tell us where you're from.
Good evening. My name is Sharon Burgess-Jones, and I live in Pensacola. How are physicians' payments for services affected by the Affordable Care Act?
Okay.
So they are and they're not. The way the insurance is sold on the exchange, remember, the exchanges sell private insurance. So these insurance companies doing business in Florida already sell insurance in Florida. And they came out with new products to sell on these exchanges, and they went to the insurance groups of physicians and individual physicians and hospitals and said, this is what we're offering you for rates. Do you want to take them or not? I'm going to give you an example that I'm familiar with that's in New York. So there are about 6 companies in New York selling the various different plans on the exchanges. In New York, at NYU, we're taking 3 of the 6. And we were able to negotiate rates for the hospital and the physicians that we thought we could work with. 3 of the insurance companies we couldn't make work. We wanted to do it. We just couldn't make it work economically, so we're not participating in them. So in our case, representing the 1,200 physicians that I do, we're going to take 3 plans, and we're not going to take 3 other plans. So we're okay with 3, we're not okay with 3. And every doctor and every physician group and every hospital is having the same conversations. In many cases, the rates didn't change. And the 3 that we were rejecting, that we did reject, they reduced the rates, because remember, they want to sell insurance to their members. The insurance companies want members. So the way they can make the numbers work for them is to lower the rates that we used to get paid to a level that we couldn't take them. And one of those companies is Blue Cross Blue Shield in New York. So we still take Blue Cross Blue Shield at NYU, but we're not going to take the Blue Cross Blue Shield product that's sold on the state exchange. You can imagine how hard that's going to be for someone signing up on the exchange to understand. They're going to come to NYU, they're going to call us, and they're going to say, I have Blue Cross Blue Shield. It says you take Blue Cross Blue Shield, but we don't take that Blue Cross Blue Shield. It's tough. It's very, very tough.
Okay.
And I'm sorry. One other thing is that the plans being sold on the exchanges, they all, whether you get the gold, bronze, silver plan, they all have a pretty high deductible to start with. So that first time you walk into the doctor's office in January, February, you're going to have to pay out of pocket if this is the plan you have, which is different. I mean, it's getting to be more common than the patient that walks in that says, "Oh, here's my $10 copay and I'm done." So when you have a deductible and you haven't met that yet, you're responsible for 100% of the cost of whatever happens to you when you walk into that physician's office. So now we're shifting the risk for collection of the payment for the services back onto the doctor from the insurance companies, because now it's the doctor's office responsible for collecting all of that money from the patient, as opposed to the doctor submitting the claim to the insurance company and they're just going to pay everything except the copay that the patient already paid. So it's definitely a shift of risk to the physicians that are taking more and more of the plans that are sold on the exchanges as well.
Okay, thank you so much. And we have one more gentleman right behind her with a question. Will you please step to the podium as we continue our town hall here on the Affordable Care Act? Your question, sir, first with your name and where are you from?
Yes, my name is Matt and I'm from Pensacola, Florida. I had actually 2 questions.
We have less than 7 minutes to answer, so hopefully it won't be too long.
I'll be quick.
Okay.
I have access to the VA healthcare system, and I was wondering, do I have to sign up for this Affordable Health Care Act?
No, you don't.
Okay.
We quickly answered that one.
Okay, that's cool.
And I'll go further and tell you that the VA healthcare system is extraordinary. So if you have access to it, it's terrific, and you should feel very comfortable with it.
Okay, thank you. And then my second question is, my mom used to have WellCare insurance, and then they basically said that they were not going to take her anymore. So she went and got Florida Blue. Does that count as this Affordable Health Care Act?
How old is your mom? Just so
She's like 76.
So she's in a Medicare Advantage plan, probably.
Yeah.
That's probably a Medicare Advantage plan.
Yeah, she's either in Medicare or Medicaid. I get it mixed up.
No, those products you just said were, so Medicare, and I'm going to let Stephen take this, actually, because he's the Medicare expert.
Yes, if your mother is 76, she's on Medicare. She may be on regular Medicare or Medicare Advantage, or she may have a supplement. And they're all different payouts for what the plans are. So if she's insured with Florida Blue now, you said?
Yeah, she just got it recently.
Yes. So, well, that's the Medicare plan, and do you know whether it's an Advantage plan or whether it's a supplement?
I'm not sure.
Okay. I suggest you go over and talk to your mom and look at her coverage and see whether it's one of those 3 types of plans. Okay. And each one will have a list of providers, and you can go on Medicare.gov and compare the plans.
Okay.
But she has coverage. She won't have, I mean, she doesn't have to, I mean,
She's not
Stephen's right, but she won't
impacted by
impact you,
this.
and she's protected.
Great.
Okay. I'm so glad we could answer your question.
Thank you very much.
Okay, thank you for being here. I love it. He walked away with a smile. Got the information he wanted. If someone has, this is a question as well we have, if someone has, their spouse is a federal employee and has federal insurance, but they are disabled and has Medicare, should they just drop their Medicare and go with their wife's insurance? No?
No. Medicare is going to be the best policy that you can get.
Okay.
And that should stay there.
We actually do get that question a lot, because as we know, there are a lot of federal workers in this country, and all the websites that represent the federal workers, whether they're active workers or retiree workers or disabled federal workers, they all tell you to sign up for Medicare, but keep the federal workers, because you pay for your the federal workers program even after you retire. You pay a portion of the premium. It's excellent insurance, and they tell you to keep both. So
Okay.
you should have both.
Very good. And we have another question here, just briefly. A few more minutes left in this particular section of the Aware Show as we're doing our town hall here. This person from our town hall audience asked, what can be done about the fact that in North Florida, a lack of coordination among the different agencies charged with doing outreach for the healthcare law has created big gaps in the system, and that has opened the door for some dubious outfits to enter the scene. Basically, we're talking about scams here, Stephen.
Right. When any product comes out that's new and difficult to understand, it's a wide open door for scammers and people to defraud people. You have to be careful that who you're doing business with is somebody that is honest and represents the company that they say they do. If they say they're from the government, check to see that they're from the government. If they say they're from Florida Blue, check to make sure they're from Florida Blue or any of the other coverage. So you have to be careful and take some responsibility to make sure you're dealing with honest representatives.
And no one will ever ask you for your bank account information, ever ask you for your bank account information. So you do not give out any information that puts you at financial risk. No one associated with Medicare, no one associated with healthcare reform will ask you for that kind of information.
Very good. If someone wants to get in touch with Stephen, Allison, and or Matthew on your program, how would they do that?
So you don't have to be a Sirius XM listener to reach us, although our producers would kill us for saying that. You just call us when we're live, which is on Thursdays at 12 noon Eastern time, because we know we're in Central time here. So it's 12 noon. It would be 11 a.m. here. Matt always helps me with that too. At 877 NYU Docs. It's 877-698-3627. And we do take emails as well to our website, which is rubenhealth.com. It's free. And we get back to everybody as long as we can.
And we can tell you do that too. Right quick, Cory, how would somebody get additional information from you as a navigator here?
Yes, ma'am. If someone wants to contact us and try to enroll in the marketplace, they can call 850-941-7156. And we also have a toll-free number. It's 888-390-5131.
And we'll try to give some more resource information in the second part
We
of
also
this.
have an email, navigator@familiescount.net.
Navigator@familiescount.net. And lastly, real quick, Ruben, I'm sorry, Andrew Rubin, Stephen.
Right. I do not do navigation or sell products, but I can direct people to the right people. For instance, Cory,
Okay.
or some of the other resources that we have in the
So
North
if they call
Florida
you, how are
area.
they going to get in touch?
Right.
They're going to get in touch with you through AARP?
Through AARP,
Okay.
I have my cards available. If you call, if you go on aarp.org, they will direct you to me.
Very good. I want to thank you right now for the time that we have with you all and that you've shared with us. That's all the time we have for now. Thank you for joining us for this portion of our town hall. We certainly hope that you will be able to tune in to part 2 of that here on The Aware Show. Until next time, I'm Dee Dee Sharp saying stay informed and stay aware.